So, good evening once again. This is the third part of our discussion with a video of key findings from Philippines Demographic and Health Survey of 2017 under the subject of community health nursing under the teachings of Ms. Jonafi D. Montero, RN, RM. Okay. Ano ko talaga? Na-fluctuate ang mind ko. Sige. So, we stopped where? Uh, Here tayo sa mga yung mga women na alam kung saan pwede magpatas ng HIV, from poorest to wealthiest women. And it is shown na may 32% sa poor and 59% when it comes to the wealthiest. So mababa talaga yung yung sex education sa lower class na mga housing ng mga women. So tuloy tayo. Naabot tayo sa violence women. Balik tayo ng konti. Here.
Wealthiest households. The NDHS 2017 provides insights into violence against women. In the Philippines, 1 in 4 ever married women aged 15 to 49 have experienced spousal violence, whether
Okay, so ito yung percentage daw. 15 to 49 will experience physical, sexual, or emotional spousal violence by the current or most recent husband or partner. So, sadly, as it is as it is looked upon now today, meron pa rin talagang nangyayari na mga ganito, which is sad. But look at the statistics, everyone. 2008 to 2017, it's going down. Sana tuloy-tuloy. Sana maganda yung statistics natin this year. So 29, 26, 24% physical, sexual, emotional, spousal violence. So withholding to confidentiality, guys, meron ba kayong kilala na naka-experience ng ganitong kinds of violence? Okay, wala. For me, I know someone. Uh, she's a very nice woman talaga. Sadly, she was just she married too soon, if I may say. And, you know, their family is still holding on. Pero, she's already separated, which is good. Which is good naman. So, yun lang. At least one of us knows someone na may naka-experience ng ganun. Hopefully, it does not happen to any of you when it comes to your own partners or any of your family. I do not wish that on you. That's all. So, continue natin.
physical, sexual, or emotional. Ever married women's experience of spousal violence has changed little since 2008. As you can see, the Philippines National Demographic and Health Survey 2017 provides a wealth of information about the population and health situation in the Philippines.
Mhm.
Results of the survey show where progress has been made, as well as areas for improvement. The NDHS 2017 was implemented by the Philippine Statistics Authority. Funding for the NDHS 2017 was provided by the Government of the Philippines. The United States Agency for International Development provided technical assistance and equipment through ICF under the DHS program, project that assists countries in the collection of data to monitor and evaluate population, health, and nutrition programs. Since 1993, an NDHS has been implemented in the country approximately every 5 years under the DHS program.
Okay, so take note of this kasi part yata to siya ng ating discussion and research. So, NDHS 2017 was implemented by the PSA, Philippine Statistics Authority. Alam niyo naman siguro yung department na yan, di ba? Sila yung magagawa ng research kung how many percentage ang ganito ganyan. So that's PSA, Philippine Statistics Authority. Diyan natin nakukuha yung birth certificates natin, I think. Tama ba? No? Yes or no? O, basta mga information natin andyan din yata as part of the surveying, researching, so on and so forth. Funding for the survey was provided by the government of the Philippines. The United States Agency for International Development provided technical assistance and equipment through ICF under the DHS program. What is ICF? Search it out. ICF. What is it? Sino nag-search? Sino nag-search?
Ano siya? International Classification of Functioning, Disability, and Health.
Again?
International Classification of Functioning, Disability, and Health.
Disability and health. International Classification of Functioning
Yes.
under
Disability,
the
Disability and Health.
Disability and Health.
Yes.
Ano yung S program? Wait lang. Assistance and equipment through ICF under the DHS program. Sige pa daw, mag-search pa daw kayo. Technical assistance with the ICF. So ICF, I think that could be part of the methodology under the DHS program, a project that assists countries in the collection of data to monitor and evaluate population health and nutrition programs. Since 1999, and the DHS has been implemented in the country approximately every 5 years under the DHS program. Marriane, i-search mo yung DHS program. Zul, ikaw naman sa ICF.
So, according here, meron silang actual official page. The DHS program is assists countries worldwide in the collection and use of data to monitor and evaluate population, health, and nutrition programs.
Which is stated right here in the video. What I mean is, ano yung meaning ng DHS? Nandito na sa video eh.
Oh, wait. I just noticed. Hold on. Technical difficulties.
What is the DHS program? Ikaw, Zul, ano ng ICF? Have you found something? Zul?
Wait lang.
Okay.
Okay, I'm not sure. But according here, DHS is commonly defined as Department of Homeland Security.
It's a
Yan ang
wait lang. DHS program. Oh, I think I know what it is now. It's the I think it's demographic and health survey. ICF, however, Yeah, tama. Demographic and Health Survey. However, ano yung ICF?
Yung ICF na I just searched it up just now.
Hmm.
Here, according sa page ng World Health Organization, ang ICF is parang like yung sabi ni Zul kanina, International Classification of Functioning Disability. Ano siya, parang World Health Framework for measuring health and disability at both individual and population levels. So, like you said earlier, it's a type of framework na ginagamit sa research ng ICF.
Okay, so it's a measuring material. Ayan, nakita ko na. ICF is the WHO framework for measuring health and disability at both individual and population levels. Okay. Wala lang siyang meaning, no? Hindi siya nagapakita ng meaning. Conducts vital health focused surveys and collects data that helps US and global health agencies identify and monitor health risks and quickly deliver targeted effective interventions. Okay. So they did surveys. That's the thing. That's their methodology. They did surveys. Surveys under ICF of the DHS program. Okay, continue.
For additional information on the results of the NDHS 20,
Okay, so I think that
please
is all.
contact Philippine Statistics Authority and the DHS program.
Okay, I think that's all. So we'll continue na lang discussion by hand kung ano yung na-collect natin, um ano yung na-collect natin, ano yung mga the same points natin, and then ano yung isusulat natin sa final paper. Okay lang ba yun? Okay. Wait lang naman. Okay, so we are now going to continue our discussion. Sorry for the slight pause of the meeting. So, sa number one question, guys. Ano ba yung number one guide question natin? What was the methodology used in the National Health Situation Survey? So, ano, like interviews ba? Or is it collection of data? Hindi, imagine mo naman, alangan
Through interview.
mag-interview ka ng 27,496 na mga household. Kaya mo yon?
I mean, to be fair, they are an organization, so it's actually possible.
It's possible. Oo. Pero like, interviews ba talaga or is it just a survey? So this is in survey lang naman, baka may gina-check-check lang silang papel, then they just collect the data, organize it, then there's the research. Or
I'm
pati
assuming na
nakikita ko din kasi observation. Gina-observe nila, di ba? For 3 years, they observe the children who are live birth, right? Okay. Kayo, ano opinion nyo?
feel ko, you're on the right track is most likely kasi since they usually hold the records, especially in mga, like sa mga centers, of course, meron silang makita na palagi silang ma-receive na any updates or, also, of course, I'm pretty sure meron sila ginagawa na parang yearly observation.
Yearly observation. Yeah, pwede. Oo, ano. Pero ang napapansin ko din
Yeah.
kasi yung manner of collection for the
Observation.
PSA. Ano yan, Zul?
Observations.
Kaya nga, observation din. Pero alangan,
Kasi
sabayan niyo yung,
pag-interview, di ba?
ah,
Pag-interview kasi, di ba, it takes time.
it takes
So,
time.
pag,
Yes.
hmm,
Oo nga. Pero at the same time kasi, na-remember ko, yung SKSU, nag-collect sila ng data from each family household. Parang community health nursing din nila. Oo. Tapos, they interviewed each household, separated into different clinical instructors. So, ganon. Gets? Tapos para daw sa PSA, Philippine Statistics Authority, which we get naman, no? So, I think may part doon na interview, right? Sige lang. I-research lang natin yan. Then, ano, would you agree if we'd meet tomorrow? If we meet tomorrow
if walang
morning,
klase.
let's say kunwari walang klase sa care of MCA. Do you think we should meet for discussion?
Okay lang.
Okay.
Okay lang din sa akin. Of course, for to get the work done much better.
If ever lang naman na walang klase sa
Tapos hanggang 10 tulog si Marian.
correct.
Hindi naman ganon.
Sige lang.
Grabe naman.
So
Kailan
yun,
ko din magising.
ang collection naman natin is observation, survey, and interview. And then, ano ba tawag doon sa data collection na naga-base lang sila sa records? Research, no?
Research.
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 Sige lang, we'll just discuss this furthermore soon. National Health Situation Survey, NHSS. Try nyo din i-search to mamaya. So, what was the size and composition of the sample population? May nakuha kayong notes. Ang nakuha kong notes, 27,496 households, 25,074 women within ages 15 to 49 years old. So 99% of households responded and 98% of women had responded. So it was sent in a national level with between urban and rural. Ano ganun yung meaning ng urban? Oh, 'di ba naturo 'yan sa PE natin? Major in Physical Education. Sige. Kasi naturo din 'yan eh. Urban and rural. Urban is city, right? Huwag mo nang i-type, Marian. Sabihin mo na lang. Sige na.
Yes. Urban is yung sa city or parang within the region,
Within the region. Within the
I
region.
think.
Tapos, rural is more provincial, right? More on, basta mga ganyang areas. So, urban and rural within 17 administrative regions, right? Okay, 17 administrative regions. Meron pa kayo nakuha na data for size and composition? Or the same lang tayo?
I think it's the same, at least for me.
The same.
Okay. So
Same.
next, we'll have primary health indicators or metrics highlighted in the video. So ano daw ang nagasabi ng health or mga factors na nagasabi ng health sa Philippines? Ano?
Wait, can you kindly repeat the question?
What were the primary health indicators or metrics highlighted in the video? Ano yung mga important statistics ang nilagay sa video? Na nagsasabi na yun daw yung indicators nila sa health for the Philippines.
Well, for one is especially talaga yung fertility rate.
Fertility rate.
Another thing I've noticed is about yung mortality rate ng young children.
Yes, childhood mortality. What else?
as well as yung family planning and spousal violence.
Family planning and what?
Violence.
Family planning, yeah, and spousal violence.
Spouse violence.
Ano? Violence?
Spousal violence.
Spousal
Spouse.
violence. Okay. So, dagdagan ko lang dyan, vaccination charges and people who use PhilHealth insurance coverage. So, yun lang. So far, yun naman. Next question. What were trends or charges in areas such as mortality rates, disease prevalence, healthcare access, or maternal and child health discussed? How do these indicators affect the overall health status of the population? So yung mga trends or charges daw. So we have the vaccination charge, the usage of family planning. No, parang mixture sila ng third
Uh,
question.
um, Amanda, I think that's supposed to be change.
Change, I think, changes. Oh yeah, changes pala. I'm sorry. O sige. O sige, what were were trends or changes in areas such as so on and so forth discussed. Oh, so na-discuss ba daw ang mga changes ng statistics throughout the years? Yes, right? Kasi we see the decline, the fluctuation, the uprise, the downfall, so on and so forth, di ba? Okay, so how do these indicators reflect the overall health status of the population? Paano natin makikita yung mga fertility, yung mga health, ayun, childhood mortality, spousal violence? Paano natin sila makita as health indicators ng Philippines? Do you have any opinions? Bilisan nyo kasi 6 minutes na.
For me, as I observed during all the trends and changes, I realized na there are merong health indicators about how back in the day, how much na lack ng health knowledge and how much that actually changed the status of the population. Just needs some health awareness, pati rin, I can't properly explain it for some reason.
Oh, sige, sige. Zul, ikaw, do you have an idea? Zul! Nagka-record ba ya, ha?
Yun, tama man yun.
Tama ngayon, but I
Yeah.
want you to explain it yourself then.
Hmm. Tama yun.
Oo nga.
Like,
Sige
kasi
lang.
di ba, yun nga
Take your
sabi ni Marriane back in the days, di ba?
Mm-mm.
I-add na lang natin dun yung di ba back in the days, mga incomplete equipments, mga
Yes.
ganun. Like yun, mga ganun. And at least nakita natin ngayon na there's still improvement sa mga health center natin.
Sige. So, dahil sa mga indicators na yun, paano daw nila makita na yun yung indicators ng health sa Philippines or kaya sa country? Paano natin makita na yung violence, mortality, fertility? Paano nila makita na those are health indicators sa Philippines, na healthy ang isang country? How do you think they'd say that? Hala. Sige ako, I think I made my idea naman ako. Can I share? Sige. Siyempre, makikita natin na healthy ang isang country dahil dito sa mga first of all, fertility. Siyempre, kaano kadami o kaano ka-knowledge ang mga Filipino when it comes to family planning, to childcare? Paano natin malalaman na overpopulated ng isang country? Are we underpopulated? Do we lack children? Do we need more? Do we need less children? Like, we know how to control our population by manners of family planning, so on and so forth, and the fertility din as well. Kasi if hindi fertile ang mga women natin, we would lack. We would lack our population. Yung parang Japan lang good na bumababa na ang pagiging trend ng pagiging buntis. Therefore, bumababa na din yung growth ng kanilang population. Tapos additionally, sa childhood mortality, syempre, kung hindi mabuhay ang bata sa isang country, paano nila natin malalaman na healthy ang isang country? Right? With someone who has strong immunity, tapos bigla na lang mamatay before the age of 5. That is sad, right? Additionally, vulnerable din. So, if hindi good ang environment nila dito sa Philippines, ano na lang kaya sa general term? So, that's another health indicator. Ano pa ba? Yung birthing in health facilities. We have enough health facilities to take care of children, take care of the children, take care of people in general, hospitals, clinics, community hospitals, di ba? Kung wala tayong health facilities, walang growth sa isang barangay o kahit secluded na area man yan, di ba? Then vaccinations. Are we safe from any diseases? If people, excuse me, if people would travel into our country, are they safe from the diseases that they are vulnerable of? Uh, for polio, polio is still a great thing today. You and I might have polio, but because of the vaccine, we are immune to it. Tapos, ang ano lang nga, if mapasa man natin sila sa ibang tao kasi hindi sila vaccinated. You know, there are situations like that na ba't mo hindi pinapaano yung anak mo, ba't hindi mo siya binigyan ng ganito na vaccine? Of course, ma-open na din sila sa risk. So how do we protect ourselves from those kind of pains, risks of illnesses, di ba? Health threats, kumbaga. Right, Marianne? Okay, that was unrelated, but still. So, last is violence against women. Siyempre, if we are living in houses of violence in the Philippines, how can we live as a healthy family? Right? So, yun lang. Parang major health indicators din siya when it comes to a country. So ano pa bang question natin? What is the fifth and final question before tayo maubusan ng time?
How might these indicators influence healthcare policies, resource allocation, and preventive measures in the coming years?
Okay, so paano na i-influence ang data nito sa mga future rules, policies, so on and so forth natin? Any opinions? And quick.
We now have less than 1 minute now.
Kaya nga, bilisan nyo na. Go! Siyempre, kasi alam natin yung alam natin yung mga mangyayari, yung mga kasakitan natin, mga weaknesses natin when it comes to our health. Siyempre, malalaman natin yon, then we have to form more policies, form more rules, form more laws para mabawasan natin yon, and of course to hopefully deteriorate the bad or negative changes that might occur in the Philippines in the next few years. So ganun talaga. We wouldn't know something if we don't research it, and we wouldn't see how bad or how good it would affect the Philippines if we don't observe it and see it, diba? And if we don't adjust to what is occurring to it. So that is all naman siya share ko lang naman. So I think